And many parents are breathing a sigh of relief after the CDC approved COVID vaccines for infants, toddlers, and preschoolers on Saturday. First doses could be administered as soon as today. For more on this now, we want to bring in Dr. Celine Gounder. She is the editor-at-large for Public Health at Kaiser Health News. She's also an infectious disease specialist and epidemiologist at Bellevue Hospital and New York University's School of Medicine. Dr. Gounder, so I said, many parents are breathing a sigh of relief, but other parents are kind of still got a lot of questions. They're still concerned. So let's try to sort of clarify some of the stuff. We know that this is going to be a reduced dose for these wee little babies and infants and toddlers. But give us an idea of the size of the dose and then just how effective is it then if it's a reduced dose?
So there are two options. You have the Pfizer vaccine and the Moderna vaccine. So the Pfizer vaccine, the dose is even smaller. It's the smallest dose. You do require 3 doses as a result, and it means that kids will take a little bit longer to reach full immunity because they do need all 3 doses. The upside is because it is an even smaller dose, your risk of fevers, which is really the most common side effect with these vaccines, is going to be a little bit lower. Okay. The Moderna vaccine is a bit higher dose, but you only need 2, and kids will reach full immunity sooner. So, it just depends a little bit on your own personal feelings about how quickly you want your kid to be fully immune, whether you want 2 or 3 doses, and whether you want the lower dose.
And do we have an idea, it's reduces, I don't know, hospitalizations by 40% or 50%, or what are the numbers they're throwing around?
So the best data we really have is on the antibody levels, and both vaccines do produce good antibody levels that are correlated with good protection. The numbers of infections that we saw in the trials were very small, so those estimates of efficacy are really shaky, and so I wouldn't compare the 2 vaccines based on those numbers.
If you received the vaccine while you were pregnant, and we've always been told that, the mother gets to share the antibodies with the babies, does your baby still need to get a vaccine?
So remember, babies can't get vaccinated until 6 months of age. The mom's antibodies hang around probably until about 6 months. So it's really important for mom to get vaccinated to protect her baby until that age of 6 months, but then for kids to also get vaccinated themselves at the age of 6 months and onwards.
Okay, so what about side effects now? I know I was fine with the first 2 doses, but the 3rd dose, for some reason, I was really under the weather for 24 hours. But these are kids that don't have language. They can't tell us what's wrong with them. What should parents be looking out for?
Fever is really the most common side effect. And when little babies, when kids have a cold, infection, often have a fever, they may not sleep as well, they may not feed as well. So those are often signs that the kid may be having some side effects.
Do we know, I know I'm just throwing questions at you, do we know how long the vaccine will be effective for? Is there a possibility that we're talking boosters, I don't know, a year down the road?
Maybe. Probably. A lot of this depends on how quickly the virus mutates. So when we saw Omicron emerge over the fall, that really threw a wrench in our plans and our assumptions about how long the vaccines would protect us. So it really depends on what the virus decides to do over the coming months.
Okay, so and another quick question. What do we know about the severity of COVID versus flu in children of this age group? How does this compare to the number of children who are hospitalized for the flu versus COVID?
So many people have unfortunately been spreading what is frankly misinformation, that COVID is just the flu, even in kids. And that is not the case. We've known this for some time, but there's been a more definitive study looking at kids who were admitted to ICUs both before the pandemic from the flu and during the pandemic from the flu compared to kids who had COVID and ended up in the ICU. And it is very clear that COVID is causing much more disease in little kids, as well as being much more deadly in little kids.
All right, now that is all information everyone can use and take to your pediatrician. Dr. Celine Gounder, thank you very much.